Welcome to Innovators, a series where we sit down with thought leaders in the healthcare technology space to discuss some of the latest trends impacting the industry today. My name is Justine Giancola. I'm on the corporate communications team here at Inovalon, and joining me today is Karen Knight from Face Rock Enterprises. Thanks so much for being here today, Karen.
Glad to be here.
So we're just going to get started with kind of hearing about your background in healthcare and what it is that you do.
Okay, I have been running hospitals and clinics for 30 plus years, large health systems. I worked after about 25 years in working with hospitals, I moved to working with a large insurance carrier and worked as the executive director over tribal relations, and then went to work for Face Rock Enterprises, which is a tribal consulting firm. I had gone back to school and I probably did this really late in life, but went back to school and got my Indigenous people law degree, and then was able to help tribes as I developed programs specifically for them.
So you mentioned getting your Indigenous people law degree. What prompted the interest in tribal health?
My family is Eastern Band, Cherokee, and Creek, but my father was adopted, so I have no native blood. But I watched my family and the things they went through with Indian healthcare, and I wanted to use my expertise to help bring in more funds that would help take care of the need that's there. Indian healthcare is funded about 40% of the cost to render the care. So they're highly dependent on third-party revenue. And tribes were not even allowed to bill insurance until the mid to like 2007, 2009, right around there. So they could only bill Medicare and Medicaid. And then the federal government allowed them to start billing. So they're a little bit behind on the billing and getting insurance contracts than what public sector is. So I wanted to use my skill set to try to help them bring as much revenue as possible to be able to change the way healthcare was received. The tribes, they have a referral process where they rate their urgency of the referral, and it's based on a 1 to 5 urgency. It could be someone going from life and limb to organ failure to even down to an MRI if you have a back pain. And I found that members were having to wait 6 months, maybe a year, might not even get approved to have that referral for that MRI. And I thought there's got to be a way we can change this. Well, we needed to bring in more money and more funds. And the whole idea was to bring in more funding so that it would support the programs, because everything that they do goes right back into the programs. And the more funding they have, the more people they can help. So I'd like to see those 1 to 5s all covered. So when you need a referral, or maybe to a dermatologist, you can get that referral if you needed something like that. So my job with Face Rock is I go in and I evaluate the current tribal health system or help them develop a tribal health system. And then we see what we can do to help improve that revenue cycle. Many times when I go in, the error rate for claims is around 65 to 75%, which is really hard to run a health system when you're only getting funded 25% of your claims volume on that. So we go in and we train the revenue cycle, and once we get them trained, then they start improving drastically. We've seen the results go from error rates the first month, it starts out at 75%, and then within 30 days, the error rate drops to 20%, and then by the time 3 months to 4 months, we're at 2 to 8%. So really helps tremendously so that they can bring in those funds that they've earned, they've already worked for. Many times the tribe will bring in employees who have not had much experience in healthcare, and they're dealing with an antiquated system. So a lot of times the tribe has not bought a new EHR. They're dealing with RPMS, which is very antiquated. It is a DOS system running in a window, and it's very difficult. So you'll have young people that will need to come in and hire, but they don't want to work with the DOS system, and they don't know what hotkeys are, and they don't understand any of that. So we bring in Inovalon to attach on to that program. And then they're able to do all their work in Inovalon, which makes the claims fun to do. In fact, they refer to it as being almost like a video game, especially compared to RPMS that they're working with. So they'll work these claims, and it's how many can they get done and how can they get that error rate down. And we develop just the whole career development for the employees, because many of these tribes are in remote areas. So trying to find someone who has experience in claims is not always easy. So if we can do a homegrown program and help them develop that, they gain that confidence through Inovalon. And they also really like the training videos because they can listen to a 5-minute training video on something, and then they become subject matter experts. So we've watched this happen, and people have just really come into their own with this. So the more money that we can bring in and the more efficient we are on that collection, the more that it can be put right back into that health system so they can help more people. So tribes they put that money right back in, so it doesn't go to bonuses or any of that, it goes to helping the people.
That's awesome. I love to hear, RCM is very focused on the revenue and the dollars, but to hear it come even back around to the actual patient, the improved outcomes, that is something that is so important to us at Inovalon. Thank you so much for joining us. It was great talking with you today. And thanks to everyone who tuned in. Be on the lookout for our next episode of the Innovator series.